this meeting. Allow us just a few more minutes to let other participants in. I see that we do have quite a number of you joining. So just give us a few more minutes just to let others in as well. But thank you so much for joining. And I hope that you can hear us loud and clear. If you cannot, please type in the chat box so that at least we can rectify. Thank you so much. Thank you. Okay, we still are receiving quite a number of participants joining into the meeting. So thank you so much. Without further ado, allow us to start the webinar. And we want to welcome you to the Connect and Learn webinar. And the topic that we're going to be discussing today is on sexuality education for learners with disability. So thank you for joining us. We want to make sure that we should be concluded by 11:30 in the next 1.5 hours. So we hope that you can join and that you can stay with us for the duration of the presentations and all the different discussions that we're going to have. So thank you and welcome. So just some housekeeping issues. Would really want to make sure that would want to know who you are. So please share your name, your affiliation and country in the chat box. Whilst you wait for others to join, may you please share your name, your affiliation and country in the chat box, or add your affiliation and country name next to your name using the following steps. I hope they are very clear. That you need to go to the icon for participants and then you rename. We want to encourage every person to make sure that they put their full names, and we want to know the countries that you're representing as well. For security reasons, we will disable any participant that does not have any clear identification on their screens. We need to make sure that we have clear identification on your screen. So I'll allow you a few more minutes to rectify this. Thank you. Right. If there's anyone who needs any assistance to make sure that you rename, please also just type in the chat box so that we can support you to make sure that you can register correctly. Thank you. Right, allow me to introduce myself. So my name is Tembile Chiware. I'm the lead consultant that is supporting UNESCO in facilitation of the community of practice regional webinars. So we really want to welcome you. So this is my name, and you're going to find all the different participants that we're going to be working with. We'll introduce them as we go further. So just a few housekeeping rules. As we have alluded, the webinar, if you saw in the registration forms and all the registrations we've done for those that have joined the community of practice, the webinar needs to be a safe space. So we need to make sure that we ask everyone to respect each other's views. Participants who do not comply will be removed from this webinar and future webinars. So we need to make sure that each and every person is participating freely to share their views, without any fear of victimization or any judgment. So kindly use the hand icon should you wish to speak, and allow the facilitator to call out your name, first before you speak. So this is going to be an interactive webinar. It's going to be open to all the different participants. So make sure that you raise your hand before you speak, and we give you the opportunity to do so. We also encourage you to actively utilize the chat feature in the comments or ask section. So we need to make sure that we might not give all the opportunities for everybody raising their hands, but make sure that you type your questions in the chat box and you'll be following through. So this webinar is also being recorded. So please just take note of that as well. So thank you so much for those that are posting in the chat box. Thank you. Right. Allow me to just quickly share an overview of the community of practice. As we go through this webinar, we are going to get to know each other. We are going to do introductions as we call out your name, as you talk. So during the webinar, we'll get to know each other, all of us. So without further ado, allow me to just go into the overview of the community of practice. We share what we do and what the community of practice is all about. So it is a community of practice which comprises of multi-sectoral membership. And we encourage all the different stakeholders and individuals from across the 33 countries in sub-Saharan Africa to join. What we're trying to achieve is to support adolescents and young people's health outcomes in sub-Saharan Africa. So while we comprise of recurrent monthly regional webinars, like the one that we are just holding now, and you'll be seeing quite a number that are going to come in the near future. A mobile application with a wide range of features is available for use to make sure that we have an interactive blog and a digital library where you can get all the different resources as well. And then an online certified comprehensive sexuality education course is also available that you can also register and take the course, which is certified for you, mainly targeted at teachers. And we also do monthly newsletters. So there are quite a number of advantages that come alongside registration into the community of practice. So thank you to those that have already done. We started the regional webinars last year where we launched. At the moment, we do have just under 200 participants that have registered to become community of practice members. So we want to thank those that have already registered, but we want to encourage those that haven't to make sure that you're also registering. So the community of practice, in terms of value addition, it is a space to improve knowledge dissemination, facilitate learning, and stimulate creativity. Members who have enhanced preparedness and continuous professional development. So this is a platform where we are also encouraging teachers to reconnect those that have been trained on the comprehensive sexuality education and other key stakeholders involved in CSE delivery. So there are quite a number of regional platforms and regional trainings that have been implemented by UNESCO. Then quite a number of teachers have been part of this process. So we want to bring all the different teachers across the 33 countries to make sure that there is continuous learning and engagement on the different thematic areas that we're going to be discussing. So the community of practice will also provide a linkage and opportunity for collaborative, strategic, and technical projects, build common capabilities in CSE across sub-Saharan Africa, provide advisory role on matters relating to CSE, and then facilitate documentation of promising innovative practices in the delivery of CSE. So this is a really innovative approach that UNESCO and have initiated in the region. What we're trying to achieve is to make sure that all the different stakeholders come together and we have different conversations across issues that affect our school learners. So I want to get back to you in terms of the benefits of joining the community of practice. In the chat box, you're going to be receiving quite a number of links. There's going to be a link on how to join the community of practice. There's also going to be a link on how to download the digital platform. So if it's not working today, just bear with us. It's in the process of being updated, and you will be able to utilize it in the next few days. So why it is important for you to join the community of practice, we keep encouraging individuals to do that, including even the like-minded organizations. You'll be able to access exclusive resources in line with CSE, and you also have access to the webinars. So we have different types of webinars that we're going to be facilitating, like this one that we're going to have a public webinar, but there are others which are going to be cohorts for specific technical thematic areas. So you see that if you're a member of the community of practice, you'll be able to be engaged and invited to join some of the cohort discussions that will be underway. And then you will be able to access online forum where members can question and share ideas. So this is going to be a very live conversation that we want to have even beyond the webinars. You'll be able to access and connect to other CSE practitioners across the region, access to opportunities to contribute to future newsletters. So what we do in the newsletter, we also want to feature best practice models and best practice stories that you also need your input. So if you're a member of the community of practice, and if you do have any contributions for the newsletter, please feel free to reach out to us as well. Any person that is going to register for the community of practice is going to receive a membership card and a unique identification number, together with a certificate of membership, which is going to be given under a criteria that shows your meaningful engagement in the whole discussions and your participation in the community of practice. So these are the key features that are also underway. As we are starting this regional community of practice, we are making sure that each and every person that is joining has some form of unique identification number, also for security reasons. So like I alluded to, there are quite a number of advantages to be a community of practice member. So we keep on inviting you. We encourage you to sign up. It's a Google form, very easy to complete, that we can have your details. So make sure that you're in our database. So an example of the upcoming regional topics and webinar topics that we're going to be discussing until June this year, it's tentative. We have already started talking about the different thematic areas since last year. And as you can see, we are now in the process of having conversations around disability inclusion. And we're continuing with this conversation in the next few weeks. In the week of April the 10th, a week beginning the 10th, we have limited space to make sure that we have a cohort webinar where we are going to discuss disability inclusive sexuality education. We do have a technical expert who is going to facilitate this discussion and is going to be very practical and hands-on, sharing of tools and best practice that will be very resourceful for quite a number of individuals in this platform. The other conversations we're going to be holding in the next few weeks include engagement of community members. We want to have engagement with parents. We also want to have engagement with religious and faith and community leaders, delivery of sexual education in the digital era. So these are some of the different topics we're going to be inviting you to be part of the process. All these topics that we're going to be implementing this year were derived through a consultative process that we conducted when we launched the regional webinar last year. The number of participants that joined the regional webinar last year are the ones who gave us these suggestive topics, and we've listened and we've made sure that we're all inclusive in the processes that we do. So it would really encourage you to watch the space, watch your emails as we keep sending you the invitations to the webinars. Right. We do have quite a number of speakers, and we want to make sure that we have all the discussions and hear also your inputs within the next hour that we're together. what I encourage you to do is to make sure that you are taking notes. We have a segment where we are going to have a question and answer. So please feel free to record your questions, post them in the chat box, but we want to make sure that our presenters can present throughout the entire duration, and we let them complete their presentations, and then we open up for the questions and answers. So we do have quite a number of speakers lined up that are going to be sharing with us their best practices, their research, and evidence-based programming that they're doing on the ground. So allow me at this point to introduce you to Patricia, to Dr. Patricia Machawira. She is the UNESCO Regional Office for Sub-Saharan Africa lead. My apology, the slide is just moving. So we are excited to be having Patricia online, where she's going to give us a presentation on the 2020 study findings on the status of CSE learners with disability. Thank you so much, Patricia, for joining, and over to you.
Yes, thank you, Tembi, and thanks to your team and the UNESCO team for hosting this webinar. We are really humbled to see the participants. From my end, I'm seeing that we are at 106 participants joining the chat. So it shows tremendous interest in the community of practice. So thank you, colleagues, for your time to join us this morning. So I'm going to be talking to you about a needs assessment that UNESCO conducted on the current state of comprehensive sexuality education provision for young people with disability. So this study was conducted at the request of member states in the Eastern Southern Africa region around to better understand what is happening for CSE provision for young people with disability. So UNESCO partnered with a consultant from the London School of Hygiene and Tropical Medicine who worked with disabled people's organizations in the region to conduct the study. We can move to the next slide, please. Yes, next slide. So the objective, please go to the slide before. So the objective of the study was to capture how CSE is currently being delivered to learners with disabilities in formal education settings, looking at mainstream settings and special settings. So across the Eastern Southern Africa region, you will note that young people with disability can either be found in what we call special schools, but there are also young people with disability who are in mainstream schools. So the picture across the region kind of shows a mix of these two approaches, and with challenges, obviously, with implications in terms of reaching young people with disability. So the study was looking at the provision of basic CSE in basic education, including both primary and secondary schools. We aimed to identify the current needs, the challenges and opportunities of learners with diverse disability types in relation to CSE, to identify the support that teachers and schools need to ensure effective delivery of inclusive CSE to learners with disability and how this should be best provided, and then to map out organizations who are working on this issue, and to also see what resources are available, and based on the findings, to make recommendations on the pathways to delivery of CSE in the Eastern Southern Africa region for learners with disability. So the study took place across 5 countries, Malawi, Zimbabwe, Tanzania, Eswatini, and Zambia. We set up an advisory group composed of experts from international, regional, and national level. We also had a number of global level interviews and mapping of resources. And then we started the study in June 2020. Following that, we had a webinar to present the emerging findings. The report was finalized in February 2021, and we've had a number of stakeholder engagements to present the findings from the study. In terms of the methodology, the research team conducted 67 in-depth interviews with key informants at national level. So these included informants from the Ministry of Education, other ministries that deal with young people with disability, international NGOs, organizations of people with disability, UN staff. The team also conducted 46 in-depth interviews with teacher educators at universities, colleges, and other teacher training colleges, 39 focus group discussions, and 29 in-depth interviews with teachers, including head teachers. 34 focus group discussions were conducted with children and young persons with a range of disabilities in both mainstream schools and special schools. And 30 focus group discussions were conducted with parents of young persons with disability. So just to take you through and give you a snapshot of the findings. So the study found that children and young people with disabilities face multiple barriers in accessing CSE in current school settings, but some of these barriers are generic issues that pertain to the delivery of CSE to all children, irrespective of disability. Issues such as prevailing sociocultural beliefs, which impact on teachers' attitudes towards delivery of CSE. There is also the issue of the complex political landscape we find ourselves in, which is not always favorable to the rollout of CSE. There are also substantial issues that we have found around inclusive education in general and not just specific to CSE. So I think what is clear is that the delivery of CSE will improve if the overall quality of inclusive education improves. So the delivery of quality CSE to children and young people with disability will further contribute to improved skills for inclusive education. So we need to be having conversations around how to make education more inclusive in general. And in doing that, we will address the issue of CSE. In terms of policies, what the study found was a generally conducive policy environment towards the delivery of CSE, but no specific attention to the rights and provisions of CSE for children and young persons with disabilities. So even though there were policies around delivery of CSE, those policies made very little or no reference at all to provision of CSE to young people with disability. And then there was also quite a commitment to the education of children and young persons with disability, with very clear, broad, inclusive education policies, but no specific reference to CSE within these policies. So in terms of it, it's looking like across these two fields, there's no point where they're intersecting. So you either have policies on CSE or policies on disability, but they don't cross-reference the other. Next slide, please. So at national level, there was an overall positive attitude. I think all stakeholders really acknowledged the importance of this work, and there was a real appetite across the countries to engage with this issue. There was a need identified for multi-sectoral working and also a recognition of the fragmentation of disability services. So here is a quote from a leader from one of the organizations of people with disability from Zimbabwe saying, "The challenge remains fragmentation of services and lack of service coordination within the disability sector itself. The more we talk to each other, the greater the impact of our interventions." So clearly there are a number of responses happening, but they are not as coordinated. Next slide, please. So in terms of teachers, what the study found was that there are mixed attitudes of teachers towards delivery of CSE in general. So provision of different components of CSE is often patchy, and we find that, scientific and soft topics related to bodily structure, functions, and hygiene are more commonly delivered than other sensitive issues. And in countries where CSE is not examinable, it can sometimes be neglected. CSE perceived as a burden to teacher workload, especially with a tight timetable, something which we found quite common in the aftermath of COVID, where those examinable subjects were the ones that were being prioritized for catch-up lessons, often at the expense of CSE, especially in cases where it is not examinable. Next slide, please. So in terms of children and young people's voices, what came out as key issues from young people's experiences were negative teacher attitudes, poor teacher competencies, communication challenges, particularly for children with disability, and particularly for those who are deaf, and frequent exclusion from peer learning. And then there was also variation across special and mainstream settings and a scarcity of resources. There's a quote there from a young person with disability saying, class assignments were done in groups, but having a disability, I used to do it on my own because none of the group wanted me to be with them. Whenever I want to join the group members refuse, saying the group is full. So just explaining how we are leaving behind the young people with disability. Next slide, please. In terms of resources, there was a lack of materials in Braille, in large print, or easy read formats for those with visual impairments. And then the lack of tactile materials for demonstration using real objects, such as condoms, was also found. And then lack of materials in vernacular. And this was an interesting one because of the quote from the young person from Zimbabwe who say, those who make these materials assume that our parents are also very literate. Disability follows poverty and vice versa. For us to be adequately helped by our parents at home, some of these materials should be in vernacular so that they are also accessible to the parents. So absence of film materials in sign language or captions, including also ICT equipment where it can be used to assist learners with disability, and a lack of awareness of the importance of adapted resources. So these are resources that are adapted to the needs of learners with disability. There was also a lack of role models. So the materials that we currently have in our schools do not show images of persons with disabilities in a way that includes some of the learners that are sitting in our classrooms. So again, a quote from a young person in Tanzania, if you can move to the next slide, please, saying, I think we are left behind because even the little available materials are not user-friendly to us. I cannot see when a teacher teaches concepts, even using objects, how am I going to understand when there's no customized information and materials catering to our type of disability? So really important to hear these voices from our young people. So in terms of the recommendations from the study, at national level, there's need for political engagement to support implementation of CSE and promote disability inclusive policies and inclusive education, strengthen the inclusiveness of child protection structures, advocate for inclusive budgeting for enhancing inclusiveness of our programming around CSE, important to strengthen our work with OPDs and parents associations, advocate for improved digital inclusion for children and young persons with disability to promote access to CSE materials. And lastly, to ensure that robust disaggregated data, which is disaggregated by age, sex, and type of disability, is collected. We can move to the next slide, please. Recommendations around teacher training. So the key recommendations were around examining and designing ways to strengthen inclusive education for both pre-service and in-service teacher training. Review the teacher training and development curriculum to ensure that all provisions incorporate an inclusive approach, and this should be harmonized with the curricula on CSE in schools. Develop a module on CSE and inclusion, including disability inclusion as part of our pre-service teacher training. Organizations of people with disability should be involved in our programming. They should be involved in training for both pre and in-service teachers. And any CPD program should take a whole school approach, including head teachers and administrative staff, Other staff, such as foster parents in residential schools, will also require training around how to best address the needs of young people with disability and also prevent stigmatizing young people with disability. Because in some cases, we do know that the stigma even comes from teachers, who make fun of and poke fun at learners with disability, which then enables other learners to follow suit and stigmatize those learners and exclude them. In terms of recommendations for schools, we need to identify how to augment learning on CSE in the classroom, building on examples already running in out-of-school settings, such as the use of inclusive social clubs and life skills clubs. Identify options for collaboration with local organizations of people with disability. Explore options for enhanced access to assistive technology for learners with disability, for them to maximally benefit from CSE. Ensure that a holistic approach is adopted for the work that we do with schools. To reduce stigmatization, a recommendation to set up an inclusive task force in schools, which incorporates children and young people with disabilities as one group. Ensure that a gender lens is used throughout the development of resources and teaching materials. To ensure that particular needs of girls and boys with disability are built into their approach. So in terms of resources and materials, ensure that our resources and materials have examples with showing children with different types of disability, and to understand that children and young people with disability are not a homogeneous group. It is proposed that there's a toolbox of approaches and responses to respond to the different types of disability that we find ourselves with in the different school environments. Around monitoring and evaluation, a recommendation to infuse an M&E framework for CSE at all levels of the education system into our existing frameworks. Explore how key stakeholders, such as organizations of people with disabilities, CSOs, and other NGOs working on CSE can support the supervision of CSE and promote good practice. This will enhance the common use of one-off trainings. And then consider developing a community of practice for this work to promote sharing of resources and good practice, either nationally and in the region. I think that's part of what UNESCO is trying to do with this Connect and Learn community of practice. And then in terms of families and communities, the recommendation to invest in community sensitization on CSE, but also on disability, build on good practice on how to shift from a protective attitude where we feel we want to protect those living with a disability to an enabling attitude, which allows us to empower our young people with disability. And also to empower their parents to be able to support them as needed. Strengthen opportunities for meaningful participation with organizations of people with disability, including women with disability-led organizations and youth with disability-led organizations, and also parent associations. Explore how to strengthen school-parent links and how parents can be more meaningfully engaged in their children's learning, and then promote family-based communication, including the development of training of adapted communication techniques such as sign language. So thank you very much. This is what I've been able to share from the 2021 study that UNESCO conducted across 5 countries. Thank you so much, moderator, and over to you.
Thank you so much, Dr. Patricia. I think this was very useful, and resources, I'm sure that you've learned a lot from the presentations, and it will be available for those that are in need of it. We'll be able to share with you. So I want to welcome more participants as we keep seeing that the number of participants that are joining the webinar is increasing. Thank you so much for your time, for joining us throughout this whole important conversations. Just for housekeeping, for those that have just joined during this discussion, we encourage you to make sure that your names and your countries that you are in are clearly labeled in your participants in terms of your ID. Make sure that you have your full name and make sure that you rename. We don't want any numbers or any identification that is unknown to us, as our ICT would disconnect you from the webinar. So this is an open discussion, and we want to encourage all the different participants to take part, but you have to do it through raising your hand, and we make sure that we give you the platform to do so. So thank you so much, Dr. Patricia. I want to give a few minutes to those that might have questions and remarks and comments on the presentation that has just been shared. So feel free to raise your hand so that we can see who needs to speak. So feel free also to have your video on as you give us your comments or any question that you have. Over to the floor. So we are looking at all the different participants we have. And if you have any questions, we see that there is one hand. Thank you very much. If there are any questions, feel free to raise your hand, or you can send in the chat box so that we can respond. Thank you so much, Anita. Anita, welcome to the platform. Do you want to pose a question? Thank you.
Yes, thank you so much. My name is Anita and I'm from IPPF. Thank you so much for this report. I think one of the things that perhaps I grapple with regard to this is, the role of the state, which I think under international law, the state has a greater responsibility to implement comprehensive sexuality education as a right, owing to the outcomes that have already been, the positive health outcomes that have already been established. And more particularly for young people or other children with disabilities, it is the greater responsibility lies on the state so that, NGOs and communities comply with the requirements that that the state through, provisions under international law have put in place. So I think that to me is more sustainable and allows the state to prepare the budgets, to put in place systems that allow, children with disabilities to be able to enjoy their rights equally alongside other children. So perhaps maybe just some comment from Patricia on that, and maybe also to see whether the report also had some recommendations on state responsibility. Thank you.
Thank you so much for your question, Anita. I'm going to give just 2 more participants a platform to pose your questions. The rest of us, please feel free to post via the chat box so that we can respond as we proceed with the webinar. So I want to call upon Danielle. Danielle, if you can pose your question, and let's make it as short as possible and also to the point if it's okay. And Cyprian in Uganda. So Danielle, over to you with the question. Thank you. All right, Cyprian, are you ready to share to ask your question? Okay, over to you.
Yes, thank you so much for this assessment. I think it's very informative. Just my take was on the part of communication challenges, as it was notified that usually the deaf children are the ones who have a gap in communication challenges, but maybe for the purpose of scope, we can also think of other vulnerable groups within children or youth with disabilities, such as those who have intellectual disability. You find that most of these adolescents are supported by their family members and their caretakers, but they do not have a say on their own, or they cannot communicate independently. But then there is also adolescents who are both deaf and blind. These ones use tactile means of communication, and that is touch. And so they are in a more vulnerable space because they communicate through touch. They cannot see and they can't hear and they can't speak. So the touch is to them is hard to interpret because somebody touching them may be communicating something, but somebody also touching them may be sexually assaulting them. And this puts them in a very vulnerable state. So as we look at comprehensive sexuality education, let's also broaden the scope to this, some of the very vulnerable groups within the adolescents and youth with disabilities. Thank you.
Oh, thank you so much. Thank you so much, Cyprian. It's well clear. And Daniel Trump, if you are still engaged, if you can pose your question, thank you.
All right, I hope you can hear me now.
Yes, we can, loud and clear. Thank you.
All right, thank you very much. My name is Daniel from Namibia. I just wanted to, maybe I missed, first of all, I did not get clear which country was the study conducted. I understand it's 5 countries, maybe if to repeat for me those 5 countries. And also what I wanted to make is, I'm not sure how was the skills, teacher skills, because back home here in Namibia, I think we have a problem, especially with this, this integrated school or mainstreaming school, where you find the special learners who are visually impaired. I can say that they are learning on the mercy, that you can find others are being told, be given handouts and books, but these poor learners, they are just learning through oral or from their own effort to make sure that they capture something in the class, and even someone has to translate for them or write for them in exam and so on. I just wanted to understand how is the situation in terms of the skills for teachers, because in Namibia really is a challenge in some of this mainstreaming schools, specifically to visually impaired learners. Thank you.
Oh, thank you so much, Daniel. So in the interest of time, allow me to close. Yes.
Tim, can I quickly try and respond to a few questions before I step off?
Yes, sure.
Thank you. So thank you so much, colleagues. Unfortunately, that because of the time, we're not able to go in depth and give you details on the study. But we have, I see colleagues have posted it in the chat for those who want to read more. Just in terms of the first question around the responsibility of the state, definitely. And I note that we do have colleagues who've joined us from government, and they can also come to the table and respond. What we are finding, and also even through our engagement with member states as UNESCO, is that there's a real issue across the region, including from government, to respond to the issue of inclusive education more broadly, but also to CSE. We do know that the challenges that we face around CSE delivery, when coupled with the issues of disability, add complexity to the issue. But there's definitely appetite from a number of stakeholders who are working in the issue. But also what we found is maybe we need to organize our efforts a little bit better, because there's a lot of fragmentation. And then there was, I think the gentleman who asked where the study was conducted. It was in 5 countries: Malawi, Zimbabwe, Tanzania, Eswatini, and Zambia. And then the other issue around, I think what the study made clear is that we need to understand that young people with disability are not a homogeneous group. So what we were finding across the region, what has more, the type of disability that has more commonly been responded to is visual impairment. A lot of, translation of materials to Braille, but the other groups, like you rightly mentioned, are a little bit more complex and have kind of not been as well addressed. So I think it's through studies like this that we can begin to shine a light and really understand the spectrum of disability, so that even in our training of teachers, they are able to identify and provide support to learners with disability. In terms of teachers, I think our teachers, what we found is that teachers have not received training, to identify and address the needs of learners with disability. So you find that our teachers, for example, delivering CSE lessons, will just deliver the lesson as if all the learners sitting in the classroom are abled in the same way. And yet we do know that we have differently abled learners at classroom level. And what we've heard from the quotes from the young people is that the young people themselves are feeling excluded, either it's through group work or either it's through the way the teacher is delivering, which is not accessible to those young people with disability. So I think the purpose of this webinar and inviting you as experts is to really start having a conversation to say, how do we respond? I mean, there's a lot that needs to be done around CSE, but there's a lot that also needs to be done around inclusive education in general. So how do we respond to make sure that we are making our learning spaces more accessible to learners with the different types of disability and intersectionalities that come along with that? So Thembi, maybe I'll stop here, and then if there are any other questions in the chat, colleagues can respond. Unfortunately, I have to leave, but thank you so much. It's been really great. I'm looking at our participants. We're at 128. So thank you so much to Thembi and your team for this opportunity.
And thank you, Dr. Patricia. I really appreciate as well sharing with us the study. And like I say, I'm sure that it is going to be easily accessible to those that request for it. Thank you so much. We do have a team from UNESCO that are also the program officers and the technical teams in the different thematic areas that are ready to respond to any questions that you'll be posting in the chat box. So thank you for engaging with us. So allow us to move on so that we can try to engage our guest speakers soon. We're excited to hear from them and all the different best practice models that they want to share with us. But before that, one of the key messages we want to give is that UNESCO, they have an amazing library of resources online, prints, and I'm sure you have seen quite a number of their resource material in the different countries. But they do have a collection of amazing videos, which are resources which cover different range of topics and can be accessed directly by the young people, the scholars, the learners, the parents, and all the different stakeholders. If you go online on the UNESCO website, you'll be able to see those as well. All right, so if we can all mute our microphones so that at least we can proceed. But yeah, we do have the amazing videos, and you also see the link in the chat box for those that want to see a compilation of all the different videos. You can then share with your networks. So we will play you one as a sample, and then we can also share with you more via the chat box. Thank you. All right, we are just putting the video on for you. I hope you can hear it loud and clear. It's just being uploaded now. Apology for the slight delay in the connectivity. Thank you. All right, I think in the interest of time, allow us to proceed, and we try to bring the videos back to you as soon as possible. Thanks. Right. We try to bring you, apologies for the slight delay, but we will play the videos and make sure that we will play it before the end of the webinar. All right, so allow me to go to the next segment where we are introducing our guest speakers. We do have quite a number of our speakers that have kindly agreed to be invited and share with us the best practice models that they are implementing at country level. We have a wide range of speakers, from the teachers that are in country with lived experience in the classroom, to policymakers, to academics, to research. So I'm very excited to be sharing with you all the different speakers that we have today. So allow me to introduce you to Miss Wezi Piri. Miss Wezi Piri, I hope your video is on so that we can see you. So Miss Wezi, she is a teacher in Malawi at a local education authority in Lodza School. So I'm very excited to be having Wezi in the platform. Wezi, do you want to say hello to all our participants and just give us one sentence that just about yourself so that we hear the work that you're doing in a very, in a very short sentence. Wezi, over to you. Thank you. We just want to hear a bit about yourself with the work that you're doing in school.
Okay, hello everyone. Can you hear me?
Yes, loud and clear. Thank you so much.
Okay, my name is Giri. Currently, I'm teaching at Mlodzairo School as a special education coordinator. I teach learners with different disabilities in a resource class. We just mix them because of shortage of teachers. Thank you.
Right, thank you. And what are your age groups? It would be good to know what age groups do you teach? Are they mixed or? Yeah.
9 to 12.
All right. Thank you so much, Wezi. So stay online. Thank you very much. And we want to introduce Mr. Webster Mashiri. He is at Nyamuka Primary School in Nyanga, Zimbabwe. So we really want to welcome you, Mr. Mashiri. Do you want to just say hello to all the participants and say a little bit about yourself and the work that you're doing?
Thank you. I'm Webster Mashiri from Nyamuka Primary in Nyanga Resource Unit, learning intellectual disabilities. Their ages range
All right.
From 7. They have various and in Zimbabwe.
Oh, thank you so much, Mr. Mashiri. I'm really excited that you joined us. We can hear it's very windy where you are, but you are very clear. Thank you so much for being part of this process. So stay tuned in so that at least you can share with us the experiences that you're having on the ground. And Miss Elizabeth Makua. Miss Elizabeth is a Senior Education Officer for Inclusive Education in the Division of Special Program at the Ministry of Education, Arts and Culture in Namibia. So Miss Elizabeth, welcome. And do you want to say just a bit about yourself and the work that you're doing in regards to disability inclusion? Right, do you want to unmute your microphone? Thank you.
Good morning. It was nice to see Patricia. I met her last year in Nairobi. My name is Elizabeth Makua. I'm a Senior Educational Officer for Inclusive Education for the I'm based in Windhoek, the capital city, and my focus is learners with visual impairment.
Wonderful.
Yes.
Thank you so much and welcome. Great. And our next panelist is Dr. Jill Hanson Hancock. So she's a specialist scientist at the South African Medical Research Council. So Dr. Jill, welcome and thank you so much for the time that you have given us to join us. Do you want to say a bit about yourself and just a few remarks in the work that you do in line with disability inclusion?
Thanks so much. You introduced me already quite well. So I do quite a bit of research on disability and with a specific focus on sexual reproductive health and rights. And I have a specific interest in comprehensive sexuality education and learners with disabilities.
Thank you so much, Dr. Jill. And we do have Miss Anzoa Fortunate Kenyi. She is a Senior Sexual Reproductive Health Inclusion Officer at Humanity and Inclusion in South Sudan. So welcome, Anzoa. Do you want to just say hello and just say a bit of the work that you're doing in South Sudan?
Yes, hello everyone. Yes, this is Angela Fortunate from South Sudan. I work as a reproductive health officer for Handicap International, currently known as Humanity and Inclusion. So basically my interest of work or focus is looking at ensuring equitable access to family planning and sexual reproductive health services, basically for persons and women with disability, particularly under the age of 20, living within the harsh or hard to reach areas or that are affected by humanitarian crises. Thank you.
Thank you so much, Dr. Anzoa. Thank you. We do have a hand that is raised from Janvia. If you don't mind for us to proceed, you can send your comments in the chat box, but we're going to open the platform for everybody else to share once the speakers have shared their presentations and their messages. So thank you so much for raising your hand. Thank you. And lastly, we have Professor Tsitsi Chataika. She's an Associate Professor of Inclusive Education and Disability Inclusion in the Department of Educational Foundation at the University of Zimbabwe. Professor Tsitsi, welcome, and thank you so much for joining. I understand you're in Nairobi at the moment.
Thank you very much, Tembi. Yes, I'm in Nairobi. And I'm actually itching because I'm sharing the next session where I am now, and I hope I'll be able to leave this place as soon as possible. My name again, I think you've heard it, Tsitsi, and I teach inclusive education and disability inclusion, and I research and I write about those areas and also support different organizations and institutions in terms of promoting inclusive education and disability inclusion in order to make sure that we have sustainable development. So thank you very much.
All right, thank you so much, Prof. So we understand your time limitations. We have 2 questions for you, so just hang on and we'll make sure that we try to ask you as soon as possible so that we can release you. But thank you so much for giving us your time. So what we needed to do is to make sure that we get the lived experience from our teachers first before we get to the policymakers, to the researchers, and to the Ministry of Education to verify, validate, and also just make sure how the complementarity is really supporting the schools and the issues that are being raised. So I want to start with Wezi in Malawi. What are the specific challenges that the learners with disability in schools are facing in regards to health and well-being, including sexual reproductive health? So why is CSE important for them? So we want to understand the challenges that your learners are facing. Wezi?
Okay, there are a lot of challenges that learners in my school face. We have difficult to manage menstrual hygiene, especially girls who are physically disabled. And those who are not disabled, they call the disabled ones bad names. And also they have lack of privacy and confidence because of shortage of changing rooms. And there's segregation. And the last one is that people believe that those who are disabled, they don't have sexual feelings. That's a cultural belief. Thank you.
Thank you so much. All right. And Mr. Mashiri, have you attended a training on CSE for the learners with disability? And how has the training helped you in the classroom? Based on the challenges that Wezi has said, I'm sure that you have some commonalities with Malawi. How has the trainings that you have received as a teacher helped you to deal with CSE issues in Nyanga?
Thank you very much. I attended a training on comprehensive sexuality education for learners with disability. The training helped me a lot. It actually improved my perceptions and approaches to handling and teaching of CSC. I now understand that CSC is not helpful to learners with disabilities, but also to all learners.
All right.
Require knowledge and skills.
All right, Ms. Michelle, I think we're having some internet connectivity challenges, but we could hear you at the first segment. Thank you very much. I'm sure you can send some of the points that you wanted to send in the chat box so that at least we can read them out and hear you clearly. Thank you so much. So Dr. Jill, based on what Mr. Mashiri has just alluded to, we want to discuss issues around disability inclusive competence needed for teachers delivering CSE for learners with disability. So how are you involved in capacity building of teachers who deliver CSE for learners? So we want to understand from your perspective, and how can we as members support and contribute towards disability inclusiveness throughout capacity building of teachers? Dr. Jill?
Yes, thank you. I have understood half of what the previous speaker did say, and I did think he mentioned he was in a training on disability and comprehensive sexuality education. And I'm assuming I'm one of the trainers. So that's like the answer to your first question, if I'm involved in training. Yes, I am, and the trainings that we have developed and also facilitated with UNESCO and UNFPA is the Breaking the Silence intervention. Now, I think our previous speaker has already said it helped him a lot to understand that actually inclusive CSE is good for everyone. So I think that's a very I take that off, that if you get that out of our workshop, that's brilliant, that it is actually not so special. And we call that universal design for learning, to have to learn how to do that, be flexible and adjust for everyone in the classroom. I can say a little bit more about that, what that Breaking the Silence is, but I can see some people know already what it is, and I will put something maybe in the chat box as a link, so I'm not making this too long advertisement for Breaking the Silence. But your other question was, what can we do to support, inclusive CSE? And I think there's a few things that I have noted down for myself. The one important thing is to make the context acceptable of CSE in general. So if you have overarching social and cultural barriers to providing CSE in your mainstream setting, you also have it in the disability space. So what you're already doing, advocating, educating people around what CSE is, I think it's a baseline. So that means you need to address some of the social cultural barriers to CSE in general. And then also the misconceptions about disability. And there was one of our previous speakers that say that already, about the misconceptions about being asexual. In other countries, it may be oversexed, those kind of misconceptions about disability and sexuality. Providing training and support opportunities for educators. I think that was already in Patricia's presentation very clear that there's a huge need. And I think someone else, I think Daniel, was it a Daniel? That also highlight that this need for the educators to be trained to provide inclusive approaches, and that needs a bit of investment, I think, that we are able to build teachers to do that, because universal design to learning isn't that easy to learn for most subjects, but for comprehensive sexuality education, it is double as difficult. We really need people that have skills. And I think you can definitely support that we can get trainings out there. I also recommend that you, as people are evolving now with ideas around disability. I mean, my time is 10, 20 years ago, we had to advocate for anyone considering that that is important. We're clearly in an era now where this has been identified as important. It's been taken up by the big UN and nationally by education departments. So we're in a different era. So now people are coming with different ideas of what they think should be done. And I really encourage also to evaluate what works. So we understand what really reaches young people and what maybe is something that doesn't work. Yeah, I think that are my main points of what I think you can do to support this advocacy, training, evaluations, and I had one, the most important one, nothing without us, about us, include us people with disabilities in the design, in the development, and as trainers.
Yeah.
Yeah.
All right, thank you so much, Jane. Thank you. Would have loved to have your video on. If you, maybe next time I ask you to speak, we'd really love to see you at least. Maybe
oh, you could have, sorry, you could have actually just, here I am. You could have just interrupted me. Sorry,
That's okay.
I forgot.
Yeah, that's okay. That's fine. All right, that's okay. Thank you. So, Professor Tsitsi, I know that you're rushing to get into another meeting, but thank you for holding on. Well, you are very prominent in terms of the academia space and the research and influencing debate, policy and guidelines, in particular in Zimbabwe and many other countries as well. So I want to understand from your perspective in terms of evidence generation through research, your technical know-how, and what are the roles of evidence generation in advancing CSC for learners with disability, and what are the gaps? I want to combine these two questions so that I can release you. What are the gaps in the evidence base in regards to CSC for learners, and what are the roles of evidence generation in advancing CSC for learners with disabilities? So Professor Tsitsi, if you can share your thoughts on this one.
Thank you very much, Tembi, for the opportunity. In terms of the gaps, I think for a long time, we, as sub-Saharan Africa or as Africa in general, most of the research evidence that we're getting was informed by the global north, and not much was written from the perspective of Africans, which to me, whilst I appreciate all the research evidence that has been done at global level, there's this aspect of contextualizing research to just make sure that it speaks to the users of that information or the beneficiaries of that information. So that has been a huge gap. And I really appreciate, especially most of the research that has been done by UNESCO, like the 2021 global report on comprehensive sexual education, and the one that has been presented by Dr. Patricia, which is quite useful to have that kind of engagement. And I always, if we do research, I think there's been this debate that has been happening in terms of generating research evidence, the global south and global north debate, who generates research evidence and for whose purpose. So here I'm now bringing the issue of partnerships. I think the previous speaker said nothing about us without us. So I think what is important is to urge African researchers to collaborate with other global partners so that whatever we research, we can own it and we can feel that this is relevant to our context. So I think that has been a huge gap. So for me, it's actually a challenge to African researchers to stand up and research more on comprehensive sexual education and issues of disability inclusion when it comes to that area. So for me, I think there's been a gap. And if you go on Google or Google Scholar to research on who has been writing issues of comprehensive sexual research, I think you can actually see the gaps that I'm talking about. So I think it's a challenge to us and also to the global north to see how best we can partner and work together and produce evidence that benefits both platforms, the global north and global south. So for me, that's the huge challenge. Yeah.
Thank you so much. Thank you so much, Prof. Okay, go on. Sorry.
Yeah, and then the second question, it was on, remind me.
Okay, so the second question was on the gaps, but the role of evidence generation in advancing.
Yeah. So I started with the gaps, so I'm going now to the role.
Yes, okay.
You know, it's a given to say there's nothing that we can do without research evidence, because research evidence informs policy and practice. And each time when you want to, when you want to start anything or to implement anything, you want to know what's on the ground, what are the issues, what are the gaps, and how are we coming in, whether it's UNESCO or any other community-based organization, how are we coming in? So research evidence for me, it actually helps us to see, to really establish the best practices that are happening across the globe in the region as Africa, and what are the challenges and what are the lessons learned. That it also helps us not to duplicate effort, but to see how we can complement each other, and also make sure that any programs, any policies that are coming, they're actually supported by research evidence. So there is no way we can do. Remember, when we started, we started with some research evidence on what is happening and what is on the ground, so that it gives us some space to see how best we can deliberate more and understand where we are going and see the gaps and the stars that we have, in order to make sure that we have a comprehensive sexual education that is using a disability inclusion lens, so that no one is left behind.
Oh, thank you so much, Prof. Tsitsi, and I really appreciate the time. What would be very useful for you is to share with us the repository or a library of spaces where we can get credible research publications on disability inclusion. Do you have something that you can share from the academic perspective that is credible, that is, so maybe not now, unless if you just have one or two words to say, where can we get it? But otherwise, it would be great if you share via email, and then we can circulate to all the participants. But where can somebody just run to now to be able to get credible research on disability inclusion from the academic perspective?
Okay, what I'm going to do is I'm going to give you the links where I can. If there are no links, I can just give you the credible references so that we can try to look for them. That can help us, that are coming from the academic perspectives. I'll promise to do that as soon as I'm done with what I'm doing, because it's a very comprehensive thing that we are doing, and I'll definitely do that. If I forget, please shout at me.
I'll shout. Thank you. Thank you so much. I'll shout. I really want to appreciate you. Thank you so much for your time. Allow me to move to civil society. So from civil society, we have Anzoa from South Sudan. And Miss Elizabeth, I haven't forgotten about you as the Minister of Education. Normally you've got the last words. So I want to give you the opportunity after Anzoa. So if you can get ready. So Anzoa, one thing we want to discuss as civil society is around disability inclusion in sexual and reproductive health programs. So what gaps do you see when it comes to delivery of CSC for learners with disability from this civil society perspective? What gaps are you seeing? And how do you think civil society like yourselves, Humanity and Inclusion, can fill these gaps and complement in-school CSC? So we want to understand the gaps from the civil society perspective, and how and what are you doing to make sure you're complementing or you're filling these gaps. Over to you, Anzoa.
Oh, thank you, Tembi, for this opportunity to be able to share also on behalf of the civil society organization. So just
Thank you.
before
Can I switch on
I
your
could
video,
just speak about
Anzor?
some of the gaps that we would have really.
Can I switch on your video?
Sorry.
Thank you. We want to see if it's okay, right?
There you go. Yeah. So as I was saying before, I could also speak a little bit about some of the gaps that we have as civil society organization. If you look at currently the world population, there are really a bigger number of persons living with disability in the community. So
it's
at
okay.
the end of the day,
it's fine. It's fine.
Yeah, so you realize that currently, hello?
We can hear you. You can
Hello?
proceed talking while you're walking. It's fine. We can hear you loud and clear. It's fine.
Yeah.
Thank you.
So if you look at the population, there about currently in South Sudan, based on the census, it speaks about 1.5% of the population in the country are people living with disability. This was census done way back in 2018, which is even below the World Health Organization estimate of about 15%. So, of course, recently, if you look at some of the policies and attitudes have really resulted in improved opportunity for people with physical and intellectual disability. So unfortunately, of course, the society attitude still remains less in regards to this, regards to sexuality and disability. So even today, many people do not acknowledge that many learners with disability or have less information on the sexual healthy education in schools and even at home. So back to the gaps that we have also seen as civil society organization is that you realize that we have teachers that have been trained to provide this comprehensive sexuality education. However, these teachers have difficulties in really providing the CSE to these learners with disability based on the different impairments. So it's quite challenging for these teachers. They have been trained to provide, but not on the disability specific aspect of handling persons with or learners with disability based on the different impairment groups, those with hearing, the visual, and all that. And then the other also is the comprehensive sexuality education materials or the tools that are being used. They are not really accessible. They are already, of course, it's currently in South Sudan, it has been integrated into the curriculum, but the greatest challenge is that it's not accessible for these learners with disability to utilize these materials. And then also looking at some of the models that are being used by these teachers to deliver the comprehensive sexuality education. It's quite very difficult looking at some of the imaging. So even in the country, we do not have some of these models that the teachers are able to utilize to provide this comprehensive sexuality education. And then also,
I'll ask you for just a few more seconds.
We have the resistance. Yeah, so we have resistance also for this sexuality education from the parental side. So the parents are not even opting to have their learners, basically the ones with disability, to come and have attendance of classes for CSE based on perhaps also this accessing the school centers is quite challenging because most of them lack mobility devices that can support them to move to these centers for them to able to get information on the comprehensive sexuality education. Thank you. Back to you, Tembo.
Thank you so much, Anzor. I really appreciate your time and thank you. So I want to keep welcoming all our participants on the line. So please just hang on we'll try to stretch for another 10 minutes because we want to hear your perspective. We want to hear your perspective from your respective countries. So please do not leave without sharing with us what is happening. So we are only left with a couple of speakers. We'll give them, if you can also be brief as possible, those that I'm inviting to speak, so that we can leave some room for all the participants to share their stories and recommendations before we close the webinar. So allow me to extend the webinar by another maybe 10 minutes, 10, 15 maximum, just to make sure that you do not leave us before you share your perspective of what's happening in your countries as well. So Miss Elizabeth Makua from Namibia, we are coming to you now because you are from the Ministry of Education, and we want to understand the current commitments and country ratifications on disability inclusion. So how is the Ministry of Education in Namibia approaching disability inclusive CSE? And what are the remaining gaps and how are these gaps being addressed? So we want to hear the case study of Namibia and what you're doing from the governmental point of view. If I can just give you a few minutes to share. Thank you.
Okay, thank you. Can you hear me?
Yes, we can. Thank you so much.
Oh, okay. We have a 4 legal framework, and I'm only going to touch on 2 for the sake of time. One legal framework is the sector policy on inclusive education. It was implemented in 2013. So this policy, the aim is to ensure that no child is discriminated against any kind of disability. So what the ministry have in place is we have life skilled teachers from grade 4 until grade 12. And when we advertise for life skills position, we usually ask psychology as an added advantage for the applicant. And in our country, we've got resource schools, previously known as special schools. We have schools for the intellectual, visual, hearing, and learners with learning difficulties. We had a training where we trained all the life skilled teachers. The last training was in 2018. And then otherwise, we've got a pregnancy policy. And this pregnancy policy speaks to all learners with disability. So I just want to give an example whereby we went to a school, one of the resource schools, and we had a child that is hard of hearing impaired child that was pregnant, and the father of the baby is also hearing impaired. So we were very happy because the principal followed the pregnancy policy, where we advocate that no child should be sent home because the child is pregnant. Those children attend school until they're about to deliver, and then they can also come back safe at school. Otherwise, the other 2 policy, I'll just name them, but then I will not go into depth. The third policy is integrated policy on HIV prevention, management, and wellness for the education sector. And the other one is integrated school health and policy. I also want to just add that we have a national braille production in Namibia now, in Windhoek. And this braille production, we know that there were loopholes in the system previously whereby access to information was not accommodative to learners with visual impairment. So now we are able to actually braille textbooks and pamphlets to accommodate learners that are visually impaired. And then otherwise, to touch on the gaps, it was very apparent to us when we went to Nairobi from the 4th to the 7th of October. We attended a special need on comprehensive sexuality education. And there we really realized that we needed to do more in terms of material development, in terms of pictures. I think Jill and Rebecca, if I'm not mistaken, did a very good job in showing us how to develop materials for these learners, and also not to sugarcoat certain things, because normally you will see that a teacher will use a different name for, like, vagina. They will say it's a cookie, for example. Sorry. Yes, so we want to use the right terminology so that we guide our learners properly. Thank you.
All right. And how often do you review your policies? Are they not outdated? Just as a best practice, how often do you review the policies so that they're very
Actually, after
aligned
every fifth year, we review our policy. Okay. And the two policies are actually mentioned now, the integrated policy on HIV and school health. Those are new policies 2022.
Okay, good. All right, so they're quite recent. Thank you so much. Thank you so much from the Ministry of Education, Arts and Culture. I want to invite our teachers back before we wrap up with our guest speakers. So Wezi and Mr. Mashiri, just in one line, what further support do you need as teachers? What further capacity building opportunities or support do you need as teachers in the classrooms to be very effective to deliver CSC for learners with disability? I want to understand the need and the support that you need, and in terms of capacity gaps. But Dr. Jill, if you can get ready, once our teachers share with us the support that they need, can you give us a very clear criteria of the essential competencies required for the teachers to be more effective in their delivery? So to Wezi and Mr. Mashiri, just 1 minute each. I really have to shorten it now. Thank you. Wezi? Okay, Wezi, your microphone is muted. If you can unmute your microphone.
All right.
Thank you.
You can hear me now?
Yes.
Okay. The opportunity or support that we need to receive in order to deliver the comprehensive sexuality education effectively, we need resources for educators, because right now we don't have much resources. We just use books. And also we need new approaches on comprehensive sexuality through training, teacher trainings and support. This will really help communication, good communication with trainers. Thank you.
Thank you so much. Thank you so much, Wezi, and thank you for your time on the line. Mr. Mashiri, are you still online? I know that the internet was a bit poor. Mr. Mashiri, what support do you need as teachers?
Right. As teachers, we need support in actually spreading the word, awareness campaign to the parents as well as to all the stakeholders, that we in resource units, we have challenges in actually getting the learners to realize what we are saying. So if we have multidisciplinary teams and we use the multidisciplinary approach where we are saying people from different sections, from different ministries will collaborate in awareness campaigns in villages, in communities, and in our parents. I think that would be very nice if we have awareness campaign led by multidisciplinary teams. Thank you.
Oh, thank you so much. I really appreciate Mr. Mashiri. Thank you. Dr. Jill, in conclusion, what is the criteria before we release you? What is the criteria that is required for competencies? Dr. Jill, thank you.
Okay. I'm assuming it's competency to teach accessible and inclusive CSE. So I would think, first of all, you need to know what CSE is, what it really entails, that you can communicate this to other people, as for instance, in an advocacy campaign, as just suggested, you need to know what that is, and that you can and also advocate for it properly. So that's your one set of skills, your knowledge about CSE. The other one would be that you have facilitation skills to encourage social learning or to enable social learning. because CSE is not maths. It's not a blackboard to write down, calculate kind of individual exercise that you may do. It is something where you learn about social settings and interacting with other people. So you do need to have facilitation skills. This is a different kind of teaching. So I think general facilitation skills already help. Then importantly, because now we talk about including learners with disabilities, and as one of this, I think it was Webster said it, including people with disabilities and CSE is actually good for everyone. But what is necessary for that is that you understand and have skills in universal design to learning, that you understand how to do that. And I think someone talked about the pictures that we gave, for instance, as one of the resources of adaptations, and it works specifically for intellectual learners with intellectual disabilities or those who are deaf. Then you need to develop some skills to make these tools yourself. Have the courage to make tools out of everyday material and not just wait for someone to give you. Actually produce it. And a lot of teachers have these skills already. They just have to have the courage to do it for disability adaptations. And then I would say teachers need a support network to implement CSE, specifically for learners with disability. And they need to have compassion on, it's a soft skill and the ability to implement CSE despite maybe personal beliefs that they have, but even more important, despite maybe beliefs that are there from others that may, you have to be a bit more explicit when you do work with disability. I think the touch was discussed earlier, what one person touches and what another person sees can be quite challenging in terms of cultural barriers. So you have to have compassion and the ability to get over that. That's it.
All right. Thank you so much. Thank you so much, Dr. Gio. It was very useful. Thank you. I'm sure we're going to be sharing the recording to all the participants. Before we close, we want to hear your perspective. All the different participants that are still online, please hang on for just a few more minutes before we close. We have a poll that we want to just share with you, which we want to understand your perspective on a data collection basis. So we're going to be just putting a poll now, just 2 questions we want to ask you. You give us your perspective in a very few seconds before we open the forum to anybody who wants to speak or share their comments. So we're going to be receiving the poll just now. Thank you. All right. So the first question is, in your country, does your government have a dedicated office that specially addresses the needs of learners with disability? So can you just type yes or no, and then we can know, we'll give you just a few seconds to make sure that you've responded to the poll. We need all the participation we can get. We're just under 40%. So if all those that are online can just put their responses. In your country, does your government have a dedicated office that specifically addresses the needs of learners with disability? Thank you so much for those that are sending out the poll. A few more seconds. We are now at 51%. Right, so if you can please put your responses on the poll, say yes or no. We're trying to get to 100%, that would be really good. But so far, we have 88% that are saying yes, this is very encouraging, and 13% are saying their government do not have a dedicated office. So it's really good to know. It would be good, maybe in the future conversations, we can share the best practice models of those government offices that do have dedicated offices as well. Thank you. All right. We are going to the next question. Thank you so much for those that have participated. In the interest of time, allow us to move to the next question. Thank you. Right. I think we can share the results. So you can see the results. It's sending an 86% are saying yes and 14% are saying no. Would really want to know those that have countries that are saying no, they don't have a dedicated office. Please do send the names of your country in the chat box so that at least as we do programming, we are also cognizant of this factor. Thank you so much. Right, on question number 2, we're trying to get to the next question before we close the poll. Question number 2, do public schools in your country offer ICT training that is inclusive of learners with disability to enable them to navigate online sexuality education? Thank you so much. Do public schools, I know quite a number of private schools could be offering this, but we also need to know, we need to make sure that we have evidence for it, but we want to focus on the public school that are accessible to the majority of learners. So do they have ICT training that is inclusive of learners with disability? Right, thank you so much. So we do have quite a number of responses. 92% are saying no so far. And then 11% are saying yes. So just another 5-10 seconds. If we can encourage quite a number of you to vote, that would be wonderful. All right. Thank you so much. So we are at 91% are saying no, and only 9% are saying yes. The public schools offer ICT training for inclusive disability. Thank you so much for participating. At this juncture, allow me to ask you to raise your hands for those that want to share. We'll try to limit the conversations as much as possible and make sure that your contributions are short. We also encourage the chat box to still be interactive, open, send as much information in the chat box, including any contact details, if you want further engagement with the team. So do we have any remarks or any questions from the participants? I want to give this floor to all our participants to share, or if you have any remarks you want to add as well. All right, we're not seeing any hands yet. The Amaze video is ready. We would love to share with you, but maybe we can share towards the end. But I wanted to give an opportunity for those that want to raise their hands. All right, while you think about raising the hand, so Juniors, thank you so much. You've raised your hand. Just give us a few minutes to play the video, and Juniors, soon after the video, please just share your thoughts as well and your comments. Thank you. I'm really sorry we're running a bit over time, but thank you so much for remaining engaged. Okay, thank you.
Great. So I'll see you at 7.
Hey, Alex, was that about the Youth Debate Club? I have a new topic we can discuss. Shako Black Panther. It's gonna be incredible.
Oh, sorry. I was gonna tell you. I can't make it tonight. I'm actually going to a movie with Jabu Sonke.
Jabu Sonke? Student body president, first chair drummer in stage band, 5-time debate winner in our school team. She's so cool. I didn't even know you were into that.
What do you mean debating?
No, like, you know, dating. I mean, I hope it's okay to ask, but can your parts, like, do stuff?
Actually, my parts work just fine. Just because I'm in a wheelchair doesn't mean I don't have crushes or feel attracted to people. In fact, no matter what our bodies can or can't do physically, people with disabilities have the same sexual and romantic feelings as anyone else.
And, like anyone else, people with disabilities have various sexual orientations and gender identities too. From heterosexual to gay, cisgender to trans, across a full spectrum of sexuality. But are relationships more difficult for people with disabilities?
Well, regardless of my physical ability, I want the same things from a healthy relationship as everyone. Respect, communication, consent, and fun. And like everyone, I sometimes have questions about relationships. Like, how do I know if someone's interested in me? How do I ask someone out? Or how do I turn someone down if I'm not interested?
Putting yourself out there and trying to date can make anyone feel nervous or scared. But the more you educate and understand yourself and your own value, the better you'll get at feeling confident in making healthy decisions.
There are certain issues that people with disabilities could be more likely to face. Sometimes it can feel like parents are overprotective when it comes to dating. Or friends might not think of us in a romantic way because they don't understand that we have the same kinds of feelings. And there are some specific challenges that a person with disabilities might have to deal with. For example, if you have trouble communicating verbally, you'd have to find ways other than speech to express yourself or give consent, like using body language, adaptive devices, or pictures.
Think of it this way. Everyone's body is different and needs help from time to time. And regardless of a person's physical ability, they can have the same feelings, hopes, and dreams as anyone.
Thanks, guys. I think I get it now. Sorry I didn't understand before, Alex.
It's okay.
And you know what? I've got something that's gonna make your date with Jabu even more awesome. One double nuts chocolate bar with mint chips and caramel, and a honey bar with icing.
Thanks, but were those in your pockets?
Just since this morning.
Ew.
All right, thank you so much, Darlington, for sharing the video. I hope you enjoyed the video, but it's also very more informative. So our team is posting the link in the chat box. If you want to see the link for the video, please feel free. It's a very big resource space within UNESCO website that you can go and see quite a number of videos on different thematic areas. It's not just the only one. So please do visit the website. All right, so juniors, thank you so much, Junior. You want to introduce yourself and tell us which country you're coming from and your perspective. Thank you.
Yeah, thank you very much, ma'am. My name is Junior, as reflected on the webinars. I'm from Namibia. I'm heading school, one of the primary school public in Namibia. So I don't have much to say, but what I would like to point out here, I want to indicate that this is a quite educative platform that provides us as a principle when it comes to sexuality, more especially our disability. Because what is happening what my experience as a principal for quite a number of years is that this learner, we are not that much care of them. And to a certain extent, they are not on the safe side in terms of their right. So I would probably further engage probably our ministry, so and also as well as UNESCO, at least to have some proactive policies that address specifically the need of these learners. I would like to say one of the examples, I was having one disability learners at the primary schools. But when she go to the secondary school, that learner got pregnant. So it means that the people are using that, that disability as a springboard to override the right of this kid. So at least if we can further engage probably our policymakers, so that the sexuality part of the disability learner, they can be addressed specifically and monitor and evaluate. That's my thought.
Oh, thank you so much, sir. This was very useful. And we want to encourage everyone on the platform to share any best practice models, any tools and work plans, anything that you have that you're using within the classroom that we can share with other countries as well. We want to make sure that we are knowledge sharing. It's a platform that we exchange notes and make sure that every person learns the best practice models that are happening elsewhere. Thank you. Are there any hands that you need that I'm not seeing? Anybody else who wants to contribute? I'm seeing a lot of comments that are coming through the chat box. Thank you so much. Anyone else who wants to say any other comments before we conclude? I'm just being very cautious of time as well. Yes, okay. Okay. Yes, please proceed. Right, Janvia, if you can introduce yourself and the country and your remarks. Thank you. Janvia from Rwanda, I hope you can hear us. All right. Janvier from Rwanda, going once. All right. I think we need to make sure that we're. Hello.
Hello.
Hello, Janvier. Hi. Welcome. Welcome. If you can introduce yourself, give a few remarks.
Thank you very much. My name is Janvier from Rwanda. Currently, I'm serving as a teacher. I want to talk about disability intervention in our teacher training centers and the initiatives the government had put into force. The government started to introduce some initiatives of using assistive devices from the teacher training centers so as to form the teachers of tomorrow how to use those assistive. I want also to thank the government and some humanitarian activists who are working alongside the country about the inclusive infrastructure which are being put in different public schools. Thank you very much.
Oh, thank you so much. It does seem Rwanda is one of the best practice models that we should learn from. So, Mr. Janvier, if you can please type in the chat box, just type the assistive devices that you have, the specification, who you're giving it. We just want to hear more details from you. Can I ask everybody to mute their microphones, please? Thank you, so that we close. Thank you so much. So, Mr. Janvier, if you can share as much content as possible, we will get your details so that you can share with us what's really happening in Rwanda. But it does seem like a best practice model. Thank you so much for sharing the positive developments that are happening there. So in terms of takeaway messages and the next steps, we need to conclude this webinar. Thank you so much for remaining online, and it has been very informative. I wish you could do this all day, but what we can promise you or guarantee you is that we try to have as often as possible. At least we'll try to have twice a month. We will run the webinars twice a month. One could be the public webinar, and then the other one would be with a smaller team, which is a cohort, where we have specific topics that are very practical and making sure that we're doing hands-on training as well. So a very good example would be maybe we do a cohort on assistive devices, and then we have teachers to join us and we support them on how to use them, you know, as an example. So we want to invite you. You've done the poll. Thank you so much. So yes, the next regional webinars I've shared with them earlier, that we're going to also engage, have a platform for parents. We're going to have a platform for religious leaders, traditional leaders, but we also then mix them with policymakers and the teachers. The teachers are one of our main focus stakeholders in all this community of practice. We want to support them as much as we can across all the 33 countries. So you see that the conversation is really around the teacher's perspective as well. We encourage you to join this community of practice membership. I think in the chat box, you still receive the links of how to join as a member. You receive the unique identification number with a certification over time. You'll be receiving a newsletter from us. We'll try to make sure that there is frequent as possible, highlighting the key success stories that are happening in the region. And should you want to reach us directly, please write your ideas or any documents you'd want to share with us through these email addresses. There's Nigel@Maita and Tembi, myself @maita.org. We are the technical assistant team that is supporting UNESCO to run and facilitate the webinars. And we would really encourage everyone in this platform to tell all the teachers as much as possible in your respective communities to sign up for the comprehensive sexuality education online course for the teachers. There is the link. We are going to send it on the chat as well. So this is not just for teachers. Any person can take it, but it's really very informative on how to deliver CSE in classrooms. So it's very resourceful. It has been revamped. So please, we encourage you as much as possible to spread this link to all the different teachers you know, because at the end of the course, they'll get a certificate on CSE. And we shall also start populating the community of practice mobile application. Like I say at the beginning, it's still really being updated, and we hope that in the next couple of days, it's going to be up and running. So feel free as much as you can to also contribute to the mobile app once you've downloaded it. There are a lot of directions and instructions of how you download the mobile app. Through a QR code, you will send you all the instructions online. Without further ado, allow me to thank every single person that has participated in this platform. And we are very happy and we're very excited that you have been part of this process. I want to hand over to the UNESCO team just to say thank you remarks. Any representation from UNESCO. We want to thank you for your time and that you have stayed on with us. Please join the community of practice, be part of us so that we can carry on with the engagement beyond just the webinars. So UNESCO team, thank you.
All right, Tembi, I would like to thank on behalf of the O3 team, I would like to thank all the participants for your very active participation. We went over time, but I really appreciate the enthusiasm in this group, and it was such a rich discussion, and I really like to thank all the speakers for enriching for the very rich conversation. And this is not the end of our discussion. As Tembi said, we will continue having discussions like this on a regular basis. So we really look forward to having you in our continued discussion. Thank you so much.
All right, thank you so much, Maki and the regional teams from UNESCO. And I want to thank each and every person that have registered. This was fantastic. It's a good start. This is our second webinar of many yet to come. So watch out the space and please spread the word for those that would have been part of this process but didn't. Thank you so much and good afternoon.
Thank you.